women?
Firstly, I would like to firstly say that each and every woman undergoes one type of depression, and that is PMS. We all are aware about it, premenstrual syndrome, and it starts from the age of puberty. So, from 9 years onwards. So, that is the first type. And it is very, very important to literate our girls, to literate our women that this is something which deals with the mood, with the anxiety, and we really need to just have a normal state of mind, because of course this is all natural. So these changes have to be there. Once when the girls are educated, qualified, literate about it, they feel it very comfortable, because even this is a transition stage for a girl stepping back. So this is the first type. But if the girl is unaware about it or all the time complaining what it is, then there is a chances that the girl may end up into a depression, a severe mode of anger, anxiety, mood disorders, also the sleeping disorders. So it's very, very important to understand the types of depression. Also, according to us, the severity and the frequency of the symptoms of the depression depends on every woman. It is always different to all. So the treatment is not something, one size fit for all. The treatment for depression is different to every individual, depending on the frequency and the severity of those symptoms or any illnesses. So what type of depression, how long the person is facing the depression, and what is its severity and frequency of those symptoms. Of course, there are many therapies which we undertake with them, with the client, and those are psychotherapy, one of them. Firstly, we do it psychotherapy, then there are medications, of course, there are affirmation therapy. If you have heard about bibliotherapy, then there is a need of sensitivity, positive thinking, intuitive building. What is your gut telling you, or what is your intuition telling you? Walking meditation, yoga, exercise. Then there is occupational therapy, art therapy. So you really need to educate the women to engage themselves into any sort of activity which gives them a happiness and which creates that feeling of happiness, so the person is ready to come out from the state of sadness to the state of happiness. And that is what is really, really important, because when the person starts feeling happy, start feeling life, taking life, in a very good sense, in a very good mood, and a thoughtful process. So it's about it is like, different for each woman, deriving on the frequency and the symptoms. But of course, this can be treated, and it can be gone. So it's not a weakness. Depression is not a weakness at all. It is just a state, a transition from one form to another, and every transition will always have a contraction. Even now when we are breathing, so we have the contraction and expansion of the lungs. So all transformation and all transition starts from the expansion, from the contraction, and then you move towards the transition. So of course, depression is another stage of transition, but one needs to really understand why are these transition taking place, and what are these transition taking place in my life according to the ages. As in, well, the age of women moves on, then we have the other syndromes, that is prenatal depression, postnatal depression, premenopausal depression, postmenopausal depression, relationship depression, because when one relationship fails, the other relationship comes. So these are all different types of depression. So the woman has to be very, very careful of her mind, body and spirit. You really need to have in alignment. So when you have your mind, body and spirit in alignment, you have that gut feeling, that intuition, when you have compassion for yourself. So you really need to develop self love, self care and development in order to overcome this depression. So of course we all are together in this fight, and we will support our women because we love our women.